Greetings from Billman Group of Institutions. Today, we are conducting an interactive live doubt clearance session for our registered candidates. This session, we are conducting these types of sessions at regular intervals for our registered candidates who are undergoing different server-based courses and they are posting their questions. So, this is not a course right now we are conducting, but this is a doubt clearance session for the candidates who are undergoing different courses. Now, we are having some questions today from our registered candidates. The first question you can read yourself from Dr. Pujita is that in PVS, some doctors prefer 180-degree rotation while others prefer a zero rotation for imaging. What is the difference? Now we have to understand first what the doctor means. I'm elaborating it for others. The doctor means that in some patients, some doctors, not in patients, some doctors are taking a 0-degree rotation when they are doing the ultrasound. I will elaborate what it means because Dr. Pujita is well versed of the question. I am elaborating the question for others. When you are inserting the probe, you are keeping the marker towards the ceiling. That is the zero rotation. But what if you will rotate it by 180 degrees? That means that your image will get inverted. What will happen on the screen? Your image will get inverted. That we have been taught in old school, but nowadays machine is coming with an inverted image. We don't actually need a 180-degree rotation. We actually don't need a 180-degree rotation. We just need to press onto the button, onto the knob there for invert, and the machine image will get inverted. I will come to this. So I was elaborating the question. Second is how to do a 4D ultrasound. For this, we are getting many queries because this 4D ultrasound, many doctors are, very eager to take these 4D ultrasounds. We are taking undergoing a CME very soon. We are conducting a CME, a digital CME, I mean online CME on this 4D ultrasound, where you will be invited to that. And you will be getting notified in your WhatsApp groups. And this session we are conducting for our registered candidates only, and this is free of cost. Where we will take this 4D ultrasound in detail, and we will be conducting in the end of this month only. So the last week of this month, we will be taking a 4D ultrasound CME online. And next question is from Dr. Vishal Lim. Sorry if I am not pronouncing it rightly, the name. Regarding the measurement of the ovaries, I mean the ovarian volume. I will come to that ovarian volume also. And Dr. Chandrakant is posting how to increase or decrease the size of the color box when taking a color Doppler. You are putting a color box over there. So the question is how I can increase or decrease the color box size. So I have elaborated the questions for others. Let's take the first question now. So the first question here is, now see, the footprint is over here. You are used to see footprints on the top of the machine over here. This is the footprint. So here you are having a zero rotation. You have not pressed the invert button of the machine. So when you have not pressed the invert knob, automatically this footprint will be on the top. But what is happening in the image is that with 180, now see, with 180-degree rotation, or when you are pressing onto the knob, the machine picture, the picture will get inverted. See, the footprint will go over there. So the basic important point is that there is no difference in the image quality. I'm repeating, there is no difference in the image quality, only in how the anatomy is pushed on the screen. That is the difference only. in 180-degree images on TVS, ultrasound image flips and displays the ovaries and this uterus invertedly. Now, over here, what is happening over here? Which part is this is anterior? This part is anterior. Over here is the anterior. So, what you are seeing on the screen first is the cervix and the vagina. And this fundus is not dropped actually, pasted posteriorly. Over here, you will see fundus first, and you will see posteriorly this cervix and the vaginal stripe whenever seen. So the basic important point is that there is no difference in the image quality, only the anatomical positions on the screen are getting inverted. Okay, so I hope that I have replied to the question how I can, clear all rights. So in Indian subcontinent, we don't invert the probe. I mean this image, but in Western countries, in some cities, they are inverting the image because who is taking the ultrasound pictures over there are the sonographers, and the radiologists are interpreting the image. So it depends on the demand of the radiologist whether to keep it this way or that way. Very simple. Next question. Delete all. Clear all rights. Right. Now, what was the next question? We'll go to the question. 4D ultrasound. Now, the 4D ultrasound, I will give you a basic thing. We are taking the CME very soon. You will get notified in your WhatsApp group. So for now, the question is posted. I will give you some basic important points in 4D ultrasound. When you are doing a 4D ultrasound, you are expecting clarity over there. You are expecting your 4D ultrasound to show you the fetal face, for example, fetal face, if we are taking the fetal face 4D. 2D is the basis. It is the base of 4D. So the 2D ultrasound is the base of 4D. If you don't have a good 2D ultrasound slice, never ever you will be able to see the fetal face. In this case, if we are talking about the face. Now, what is a good 2D ultrasound for a 4D? Because 4D is nothing but a, I should have a good 2D ultrasound slice. If my slice is not perfect, never ever I will be able to see the fetal face. Now, what is a good slice to get the fetal face, for example? Sagittal section. Please try to understand. A sagittal section with face up, and there has to be some fluid in between the maternal wall or placenta, whatever, and the fetal face. If the fetal face and the maternal walls are very close to each other, you will not be able to see the fetal face. So the basic important point is that a good sagittal section, when I am taking the fetal face, a good sagittal section with a sufficient fluid in between the anterior part, whatever it can be a placenta, it can be a maternal wall over there, uterine wall, I mean, anything, and there should be some fluid, and you have to take your 4D and put over here. So the basic important point is that 4D ultrasound is nothing but a superimposed 4D on a good 2D ultrasound. So, as already said, we'll be taking a 4D ultrasound workshop, not actually a workshop, a CME online. You will get notified in this week, in this month only, in the last week of this month. Now, what was the question over here? How to measure the ovarian volume? Now, see, when we are talking of volume, anywhere in the body, volume, what a volume is the calculation. Volume is the calculation of Now, for example, see to this glass or cup, whatever. And now please zoom onto my image. Now, if I have to take a volume of this cup, what I have to do, I have to take 3 measurements. So volume means I have to take 3 measurements, then machine will calculate the volume for me. What will be the 3 measurements of this cup? The height, the width, and the depth. Now, can I take on ultrasound, can I take length? Can I take length of anything, of any ovary? It can be any structure. Can I take length in a transverse section? The answer is no. Can I take width in a longitudinal section? The answer is no. So first, what I have to understand is that in what section I can take the length or width and depth. In transverse section, this is the transverse section of the ovary. In transverse section, what I have to take? I have to take a measurement from here to here. What actually, when I am taking a measurement from here to here, what actually I am taking? I am taking the anterior posterior, and the anterior posterior is the depth. So this is the depth. Now see, this D is the depth of the ovary. When I am taking from right to left in transverse section only, I'm not coming to the longitudinal section. From here to here, from right to left, whenever I am taking the width. So the moral is that in transverse section, this is transverse section. In transverse section, I am able to take the width and the depth. Before taking the width and depth, I have to press onto the volume knob of the machine. And when I am pressing onto the volume knob, the machine is asking me for 3 measurements. Machine is born blind. Machine is obeying your commands because you have pressed a volume button. That is why 3 measurements will pop up. Now machine is waiting for 3 measurements. Machine is not seeing whether you are taking it rightly or it can be wrong also. So by giving these 2 measurements, machine is taking for granted that you have given 2 measurements, and that is the width and the depth in given case. Now, how can you take a longitudinal length of the ovary? In transverse section, it is not possible to take the longitudinal section. Length. For that, what I have to do, I have to take the measurement from here to here in a longitudinal section. In a longitudinal section. So there is a dual mode in your machine, and that dual mode is not to save the paper. When you are taking the printouts, you are thinking, you are assuming that this is to just save paper. No, in fact, it is having the function to take the volume in this case of ovary. Now, when you have taken one measurement in one section in transverse and one section in longitudinal, keep it on the screen and give 3 measurements. And in longitudinal section, when you are measuring from here to here, you are actually taking the length. Now, when you have completed, you have just pressed it over here, and machine is taking for granted that I have been given 3 actual measurements. I'm using word actual. I will come to this why. Actual measurements by the doctor, and machine is giving you, for example, 20 cc of volume of the ovary. Now, you will be thinking on lines of a PCOD, that is different topic. But what if you are taking, let me choose another color. What if I will be taking a measurement over here? For example, this is of length. In a transverse section, this length in a transverse section is not actually the length of the ovary, but machine is born blind. Machine does not see where from you are taking. Machine is assuming that you have taken this in a longitudinal section, and this, if 10 millimeters, anything, will not be 10 in this longitudinal section. It can be maybe a 6 only. And this 20 will come up maybe a 9 cc only. Now, you are given by machine a 9 cc because you have wrongly taken the length of the ovary. Now, with 20 cc, you were thinking it to be a PCODs, for example, a PCODs with the 9 cc, you will not be thinking all lines of PCOD. This is why many cases PCODs are overdiagnosed or underdiagnosed because of these wrong measurements. So this is how we will be taking the clear. This is how we'll be taking the volume of anything on ultrasound, and in given cases, the ovarian ultrasound volume. What was the next question? The next question is how to increase or decrease the size of the color box. Now see, in your machine, there is a knob, which is a trackball. You know it all. This trackball is having multiple functions. Multiple functions. In this trackball, you will be having multiple functions depending on the mode you are in. In grayscale, it can be to drag to measure from one point to another by scrolling down this trackball, and you will be able to measure the length or anything measuring. Now, when you are switching from grayscale to color Doppler, the functions of the trackball will also change. Now, whenever you have put it this color box, whenever you put a color box over here, this color box will be, for example, this much of big, this much big. Now, the question is how I can adjust the measurements, how I can increase or decrease the box size. You have to go to the trackball, and by scrolling down, you will see that the box size will start decreasing from here as well as from here by scrolling down it. And by scrolling the sidewise, left side or right side, you will be seeing that this is getting shrinkened this way. So your trackball is actually a control to increase or decrease the color box size. Clear all drawings? Clear all drawings. Okay. So probably these were the questions. Let me check. I'm having two more questions. What is a pulse repetitive frequency? Now see, the pulse repetitive frequency, in pulse repetitive frequency, what is actually, some doctors are getting confused with frequency and pulse repetitive frequency. I don't have any slide of that, but try to understand. Frequency has nothing to do with pulse repetitive frequency. Pulse repetitive frequency is PRF, that is pulse repetitive frequency. There is something which is called as a duty factor in machine, and the duty factor of the machine is less than 1. What it means that it is less than 1? Machine is more of the time, total time I'm saying, in more of the time, machine is listening to the echoes, whatever machine has sent. Now, machine has sent at particular time, machine has sent, and now machine is listening to the echoes which is sent back to the transducer. Now, the total time, if I have to count it in percentile or percentage, let's say in percentage, in 1% of the total time machine is sending the beam, and 99% it is listening to the echoes coming back to the transducer. That is duty factor. Now, what is the pulse repetitive frequency? Pulse repetitive frequency is the repetition of the pulses which is sent by the machine. And if the machine has sent it now, and how long it will take for next pulse to send, that is pulse repetitive frequency. Now, the practical implementations of this pulse repetitive frequency is that if now I will put you a question, you will be giving me in comment boxes, a chat box is there. You will be giving me the answer. Let me see if you are well versed with the basic physics. Question is that if I am increasing the pulse repetitive frequency, what will happen to duty factor? This ARDNS question. Will that remain same? Will that increase or decrease? In your chat boxes now, please. I'm repeating the question. If I am increasing the pulse repetitive frequency, I am sending it more frequently. What will happen to duty factor? Will that increase, decrease, or remain same? Now, these types of questions are board type questions. What I mean by board type, when you will be if you will be going to appear someday for the ARDBS exams, these questions will be surely over there. Okay, that. Let me go to the chat box. Increase, increase, and increase. Now you will be thinking, whether others will be thinking that why it will remain, why it will increase. Okay, somebody is posting it will remain same. It will not remain same. I am getting more of increase. Whosoever has posted it, I got the answer. Others will think and will go back to the physics and think. Now see the practical implementations. Practically, if we will be increasing the PRF, adjusting the PRF rather, I will not say increasing or decreasing. You are taking a scan. Now let me put an example. You are taking a scan and you have to rule out whether we are dealing with an RPOC or a blood clot. RPOC, if there will be having a flow, right? But that will be the slow flow. For slow flow, I have to adjust the PRF. There is a knob in your machine of pulse repetitive frequency. Now you will go into your machine and you will put your physics and you will see what will happen if I am increasing or decreasing the pulse repetitive frequency. So the basic question is with what I have to do with the pulse repetitive frequency if I am dealing with an RPOC and I have to see the slow flow. I'm giving you the clue. For slow flow, the concluding question. For slow flow, whether I have to increase the PRF or decrease the PRF. Okay. Now, what was the question actually? Question was, what is PRF? PRF is pulse repetitive frequency. And the pulse repetitive frequency is the time when the machine is sending the next pulse. These things are happening at the microsecond levels. So, in screen orientation, there are some more questions, Dr. Usha. In screen orientation, nothing is mentioned about the screen orientation with transvaginal probe. Is it same as abdominal probe? In vaginal probe, the marker is kept anteriorly. So the basic question from Dr. Usha is that whether the screen orientation is same. Now, see. This is the screen of a TVS probe. This is anterior, this is posterior, this is superior, and this is the inferior, depending on whether you have rotated it towards the right or towards the left side of the patient. But what happened? We have just now discussed what happened if I am taking an inverted image, or if I am taking a 180-degree rotation, not actually rotation, I have flipped the image upside down. So where is my anterior now? My anterior is here, my posterior is here, and the superior and inferior will also change. So it depends whether you have flipped the image upside down or you have kept it this way only. So Anyhow, coming to the question, this is anterior, this is posterior, and the right and the left, if I have not flipped the picture, if I have not pressed on the invert knob, right and left will remain same, and the superior and this is superior and this is inferior, and but I have to see whether I have rotated it clockwise or anti-clockwise, like in abdominal ultrasound. The screen orientation is same condition to the flipped image. I mean the 180-degree rotation which we have discussed today, and whether I am taking it this clockwise or anti-clockwise rotation, I mean from transverse to longitudinal section. So the basic thing is that the screen rotation will remain same. I have been given a paper over here with some questions. Dr. Nivedita Teka, regarding the list of questions, because the session will be of 1 hour long. So she is online with the same. Good evening. What is the point? So these questions are not in a list. Dr. Nivedita, I have just received these questions sometime before. Your questions are how to measure and report the liver size. Is it always true that hepatitis, the liver is hypoechoic? Hepatic hemangioma and diagnosis, how to, these are the list of questions. I have received it late because I cannot explain without PPT. The PPT is the only connection between you and me. Okay, you are not physically with me. I am trying to make you feel that you are here with me and I am standing in front of you. If I don't have a PPT of the liver in this slide, how I will be able to explain? So that is why we are requesting time and again to post your questions 1 day before, or at least 6 to 7 hours before, so that we will be able to prepare the PPT for your better understanding. I will give you some clues without a PPT, but next time we'll be taking your questions for sure. Our team has noted and we will be adding your questions in next question and answer session. So regarding the hepatitis, if there is a hepatitis, this means that inflammation is there. In inflammation, what will be there? The retention of the fluid. And if there is a retention of fluid, what will be happening to the echogenicity of any organ? With increased water retention, fluid retention, will it decrease, increase, or remain same? In your chat boxes, others, please. Now, will it remain same, increase, or decrease? Let me open the chat box. Hypoechoic, Dr. Vandana Gupta, very good. Now, I got the answer, hypoechoic. So, if it is inflammation, anywhere in the body, the echogenicity has to drop. So, in your question, is it always true that I am reading it the question as it is it always true that hepatitis, the liver is hypoechoic? Yes. Otherwise, it cannot be hepatitis. Okay. Then how to measure and report the liver size in your liver? So let me take these questions today only, but without PPT, because I got these questions late. So how to measure the size of the liver? In transverse section, you can measure anterior to posterior. Now see to my body. This is anterior and this is my posterior. In transverse section, now see, I am having no PPT over here because these questions have arrived to me. In transverse section, I can measure the anterior posterior of the liver. But in longitudinal section, I can measure the length of the liver. So, for example, if you are having hepatitis in your patient, there is hepatitis. Will liver increase more in length or in anterior posterior diameter? In your comment boxes now. Repeating the question, in hepatitis, what will increase more, length or anterior posterior? Dr. Vandana Gupta, very good. I got the answer. You posted it length. Now, what will be more in, I have to see in longitudinal section, or the liver will be increased anterior posterior? In length only. In fatty liver, now the next question, in fatty liver, what will be more, anterior posterior or length? In your comment boxes now, please. In fatty liver, which section will increase more, anterior posterior or length? I got the answer in comment box, anterior posterior, very good. So you have to take both measurements, anterior posterior as well as the length. So In hepatitis, it is the length which is mostly increased. And in fatty livers, for example, it is the anterior posterior which is more increased. Regarding the hepatic hemangiomas are mm, mostly hyperechoic, and don't expect the color to do magic over there. These are the bunch of capillaries over there. But the basic point is that these bunch of capillaries does not have any lumen over there because they are very tightly packed to each other. So don't expect your color box to show you flow over there. No, it will not show because the lumen has collapsed because the bunch of the capillaries are there, and I will not see any lumen, and I will not expect any color to show me any flow over there. So the hemangiomas are hyper echoic, and the basic thing is that many doctors are thinking that it is a bunch of capillaries over there, bunch of vessels over there, and they are expecting the color Doppler to pick it color. It is not picking color. Okay, so this was all for now. We are conducting these types of sessions at regular intervals, and you are requested to put questions much before this session is started, because I have to make some slides for your better understanding. That is one. And the second is that don't post any question from the topic which you have not touched. For example, don't post any question from the color Doppler if you have not started the color Doppler yet. Okay, don't post any question from the fetal head if you have not started the level second, because maybe that it is already covered there, and most of cases, in 99.9% of cases, it is covered over there. And if still after completing the sub course you are having questions, we are here to help you. And the third and the last thing is that regarding the 4D ultrasound, we are taking these CMEs in this month only, and will not be taking on 4D ultrasound. We'll be lining up money CMEs for you, and for that you will be getting notifications in your WhatsApp groups. Stay tuned, stay safe. Thank you very much. God bless you.